Take gloves.
Ooh,
As you know, as you know, sensation in most of the skin throughout the body is served by nerves. And an area of skin that is mainly supplied by a single spinal level nerve is dermatome, like this. And there are 7 cervical nerves from 2 to 8, not C1, and 12 thoracic nerves, 5 lumbar nerves, and sacral nerves, 5. And the sensation is touch, temperature, proprioception, it means body function, and nociception means pain. And dermatome is very unique too, from people to people, person to person, like fingerprint, but general pattern is very similar. So it's important to test the landmark to test sensation. Before we get into exactly what point of body to test for dermatome, let's talk about the sensory system. The sensory system consists receptors and processing centers to produce the sensory modality, like pain, temperature, and proprioception and fine touch. And the sensory system are the nerves transmitted by tracts. The important tract is Spinothalamic tract and posterior column medial lemniscus pathway.
Oh my.
Do you remember?
Neurology.
Dermatome, not just neurology.
Processing sensation primarily occurs in the primary somatosensory area in the parietal lobe of the cerebral cortex. And this picture shows the
Homunculus.
for like 10 years in the brain. This picture's name is Homunculus. It means if you feel touch on your leg, the brain activates this spot. And you feel pain on your eyes, and brain activates on this area. This is the picture about that. This is Homunculus. And as I mentioned, there are 2 important tracts. The first one is Spinothalamic tract. It's for pain and temperature. It goes together. It starts from spinal cord and go to thalamus. So it named spinal and thalamic tract. The important thing is pain and temperature go together and cross over at the spinal cord. It means if you feel pain on your right side and go to left side on the spinal cord, go up and reach on the left side of your brain. Let's see. If you feel right side of your leg and it enters right side of your spinal cord and cross over to the left side and goes up to the thalamus and go this area and you feel pain. The second one is posterior column medial lemniscus pathway. It names very wrong, but it is the same. The before one. It starts posterior column and decussate at the medial lemniscus. Here. So it's called
Inside their brainstem.
yes, medulla. It covers for position, vibration, and fine touch. It means if you feel goes up and enter the right side of spinal cord and spread up to the middle. And at this level, they pulsate and go up, smooth and red. And you feel fine touch. Now, it's time to study important dermatomes and anatomical level. Remember that it's very unique, but it's very unique. But there are general patterns, so it's important to know about landmark to test sensation. First, cervical nerves. C2 covers posterior half of the skull, and C3 covers above the clavicle, and C4 shoulder, and C5 lateral arm, and C6 the first finger, and C7 second and third finger, and C8 fourth and fifth finger. And T4 is tested for nippoli. It's very important. And T10 is for umbilicus line. So between T4 and T5, injury. Between T4 and T10 covers the nippoli and umbilicus line. L1 is in the inguinal ligament, and L4 covers medial
Spine is
knee.
located in the really explicit.
S2 and S3
You are pointing out because
buttocks, and last S4 and S5 covers perianal skin. It's very important.
Of course, man. You have to feel it.
Your eye become catharsis.
You don't feel nothing when you poop. That sucks.
Oh my god.
There is a way to test. If you want to test
Is that
for touch,
Optimus
it can be
Q2.
done by grazing the
Motorola
skin
Droid.
with a fingertip
Motor
or
Droid.
a
Nice.
cotton swab. And if you test
It was
to
popular
pain,
2 years ago.
it can be done by applying the point of the pin. And the other sensation can be done by these blades.
This is Matman. Wow.
Let's see the one case.
Okay.
A 26-year-old man is a carpenter.
He's only 20.
Unfortunately, during work,
Oh, okay.
he got an accident.
Ah.
The drill was stuck in his spine. What will happen?
What?
Paralysis.
It would depend.
Heavy
I think he's
paralysis.
gonna get fired because that's a bad accident.
Oh.
Body.
Drip it. Ow.
Wow.
Half of his spine was injured by drill.
Brown sequence.
What?
Yeah.
Wow. No, I forgot.
It can be explained by Brown-Sequard syndrome. If he injured on the nipple level, do you remember T4 line? T4 line, nipple line. On the, he injured right side of his leg, right side of his body. At that situation,
Oh my god.
he don't have
Poor guy.
position and fine touch
Yes.
on the right
Oh my
side.
god. He's a carpenter.
And the left side, he don't have sensation about pain and temperature.
Oh, that sucks.
Because
Wow.
on the
No,
spinal
check
level,
ipsilateral
pain and temperature
and contralateral.
track at the same.
Wow.
So
So
it's
there's
a result of pain.
Wherever.
Forever, I guess.
forever, yes.
Doesn't recover.
Because spines, they don't regenerate.
Doesn't regenerate.
They're trying to study with stem cells to see if they can regenerate it, but you cannot control the regeneration, so it develops into all kinds of different things. You don't want teeth in here and all that kind of thing.
Yeah.
Teeth in your spine.
I don't think
Maybe
it's
not.
really different because the one spinal cord consists of probably several hundred thousand
Yeah, that's
different
Fibers.
fibers.
Oh, fibers.
And actually, length of each fiber is more than meters.
A meter, and that one fiber is one cell.
So actually, we cannot guarantee the wire if you
Yeah.
use
That's impossible.
cell.
that's
Yeah.
way too advanced. So.
Huh.
But peripheral nervous regenerate, but not central nervous.
It's very awful, but in the text, the prognosis is good than other syndromes.
Because, well, anyway, he has sensation, whether pain or fine touch.
Was he able to continue
No.
his job as a carpenter?
Yeah.
Okay.
And
You
in
can hit his thumb and it doesn't hurt
I
anything.
think there's some compensation because, well, anyway,
the other
let's say
side,
here you have fine touch, here you have pain sensation.
Uh,
So probably maybe you can use to.
you can get used to
You
it.
can
Yeah.
get used to.
But how about the motor?
How about motor functions?
yeah, the same side of motor is injured.
Injured.
Yeah.
So his motor is injured, so he cannot use his
Our
legs.
side is he can move.
He's just dragging
So then-
his like left.
But we can use his hand, right?
Yeah, hands are intact.
If you can't feel the pain, then isn't it like Hansen's disease? Wouldn't you have the same symptoms? Like
Yeah, but
Hansen's disease.
There are 5 different pains, sensations, but one side he lost fine touch and
Oh, you
position,
didn't lose everything.
and the other side he lost pain and temperature. So
Okay.
that means he didn't lose everything, so he could feel something.
Okay.
Yeah, on the
And in most of case, the patient's urinary function is intact.
That's important.
Yes.
Yeah.
How about defecation?
Maybe. Okay.
Pretty sure. So
That was-
he can go to
that
the
was-
washroom fine.
S5, right?
Yeah, S5. Wow, you are the only English teacher who knows S5.
It's fine.
Woohoo!
Oh,